Good evening, everyone, and welcome. I'm Chancellor for the District of Columbia Public Schools and excited that you've decided to join us this evening. Again, we thank you for your presence. I'm very pleased to welcome you all to a discussion around a safe return to school for in-person learning. And we also have tonight local health experts. But first, I want to say how proud I am of the DCPS family. Our teachers, our families since March have really doubled down on providing the best experiences for our students and families. So again, thank you staff, thank you families, thank you students, partners, and community members for the great service that we provided our families in these most challenging times. We're doing everything possible to ensure that our students have a joyful learning experience. And we want to ensure that that continues. We will continue with our creativity, but we also will continue with our persistence and unwavering commitment to our teachers and our students. We thank you for your patience. We thank you for your empathy to ensure that DCPS can meet the needs of our students and families. And that's something that we appreciate and we hope will not change as we go forward. We will continue to adapt and we'll continue to provide uh, amazing experiences for our students and our families. I'm proud to introduce to you tonight a phenomenal panel that consists of DCPS team members and health experts. Our Shanita Burney, communication and engagement specialist and chief, will lead and moderate our Q&A session. And then Patrick Davis, who leads our operations team as our chief operations officer, will also provide context on operations and reopening. Then we have the opportunity to hear from Deitra Bryant-Mallory, who is our Senior Deputy Chief for Student Supports. She will also provide more context on how we're supporting students in reopening and also in the context of COVID-19. And then we have our health experts. We have Dr. Beers, who's with the Community Health and Advocacy for Children's Hospital. And we also have Dr. Shah, who represents the DC Department of Health, as he represents as the Deputy Director for Programs and Policy. So again, thank you to the panelists for joining us tonight, and also thank you, guests and audience, for being with us this evening. I think it's important before we start with the panel to ground ourselves in our planning principles. DCPS gathered lots of feedback and input about how we would approach the 2021 school year. And based on the feedback received, we have three planning principles. And one is to continue to prioritize health and safety, to ensure that there are robust protocols for health and safety to protect students and staff. And then we also heard the important need to maximize learning, whether students are learning at home or learning at school. We want to ensure that they are maximizing every minute of the instructional day. And then finally, we continue to promote equity for every student, knowing that resources and learning materials need to be distributed based on the needs of our students and families, and we will invest accordingly, and equity continues to be a priority for us in our work. Given those three planning principles, we started to think about how we could move into in-person experiences, and we landed on a in-person experience first for our elementary age students and begin to welcome our secondary students back in term three. So currently in term one, where we're in right now, we have launched our student support centers, and they're designed to be academic supports. They're designed to provide career and technical education experiences for students, and also to provide social emotional support. They vary among campuses and what they look like, and they are all staffed by voluntary staff members, and students also volunteer to participate. For term two is where we will welcome students back into our building. And as I mentioned earlier, we wanted to start with our youngest learners. And so we'll welcome back students in grades pre-K through 5 in term two, which begins on November 9th. And then for term three, we are planning to welcome our secondary students back in term three, which begins in February. All throughout term one, term two, and term three, families will always have the option for learning at home. DCS believe that a phased in approach, as we've presented is the smartest way to open our schools with health and safety and learning top of mind. We know that this is an opportunity for families also to phase into in-person experiences in our buildings. So what does it look like for term two? For term two, we wanted to ensure that our youngest learners were receiving services. Doing learning at home, our educators made it really clear that we had many challenges with our youngest learners and their ability to have remote learning in the best way possible. And so we know our teachers were really creative. They were tapping into the curiosity of our students, keeping them engaged and encouraged. But at the same time, we knew that learning at home was not working for every family. And so as a result, we prioritize our youngest learners, looking at the capacity that we have in our buildings to serve as many students possible. And then we also prioritize known opportunity gaps among student populations in grades pre-K through 5 to mitigate learning loss. I'm going to share a little bit more about those populations that we're focused on and providing priority for. And then finally, it goes back to our principle that I mentioned earlier on the previous slide, maximizing learning. And so we wanted to ensure that we maintain the integrity of our instructional program with much time for learning, but also ensuring that there was minimal disruption for students. So as a result, we are planning to welcome our secondary students back in term three because their schedules for the first semester, which includes term one and term two, teachers for various courses that students are taking. And we believe that it would be more disruptive to provide an in-person experience for our secondary students beginning in term two. And so as we think about the term two learning models, I want to recap again what our journey into term two will be. So every family will continue to have the ability to learn from home. And families can always choose that option, whether they're in pre-K all the way up to 12th grade. However, beginning in term two, families will have an option for in-person experiences for an in-person learning classroom and a student care classroom. An in-person learning classroom mirrors the traditional instructional day and is provided by a DCPS teacher at that child's school and that child's grade level. The expectation is that we provide an in-person learning classroom at every school at every grade level, pre-K through 5th grade. We're also planning to provide student care classroom experiences as well. This is where students can be supervised by an adult that is cleared to serve students in this capacity, and students will continue to learn remotely, but they will learn remotely in a school building with an adult under their supervision. Again, that's the student care classroom model. So going forward, we wanted you to see what our classrooms will look like for in-person learning and for our student care classroom. And so here are a couple examples of what our classrooms might look like. It's important that you can see that there's space for social distancing. You can see that each student has his or her own space. And it's also important to note for our students in the care classroom, students will have the ability to be supervised by adult, but there will be devices in the classroom so students can continue their remote learning at home. Our care classroom stands for Canvas Academic and Real Engagement. We want students to have not only opportunity to have their remote learning experiences completed in a building, but students will also have access to lunch and recess and ability to socialize with their peers in the student care classroom. I want to now highlight some of our readiness checklists for our building items that will be a part of the opening experience and where DCPS will highlight how buildings will be staffed, how buildings will receive resources to ensure health and safety. So this goes back to those principles around robust health and safety protocols. And so as a result of our commitment, DCPS will be providing protective equipment and we will be providing hygiene supplies, We'll also be providing space for social distancing, as I shared with you earlier in the photos that were on the slide. And then we'll be providing water access in a safe way. And we'll be providing HVAC enhancement and ensuring that all of our plumbing systems are addressed as well. And each school will complete the building readiness checklist. We also have health and safety commitments, and these may be familiar because we've presented these previously and we've shared these previously, but just want to raise these back up, that these are our top 10 commitments to bringing our staff and students back into our building safely. And again, you see here is what reflected around protective equipment. You can see here our commitment to limiting class sizes so we can do social distancing. All of these commitments remain consistent with the CDC and DC health guidelines that have been provided to DCPS to ensure health and safety of students and staff. We have also asked our families to begin to think about what they will need to do to participate in in-person learning experiences. So of course, we want all of our students to have clear immunization records, but we also will be asking families on a daily basis to complete what we call Ask, As, Look. This is a process that we would want families to do on a daily basis to prevent positive individuals entering our campuses. And so we would ask that families follow this screening process each day. And we're also asking that staff follow this process each day. The Ask, As, Look protocol is an important step, again, to ensure that we proactively identify any student or staff member that are exhibiting symptoms of COVID-19 or may be possibly exposed to COVID-19. I'm so glad that you joined us today, and you'll get an opportunity to hear from DCPS, but you also get an opportunity to hear from our health experts. We're all here today as well at Maury Elementary School, and you'll see pictures or backgrounds associated with the campus here. And it's just a reflection of how excited we are to begin the process of reopening schools like Maury Elementary to all of our students across all 8 wards in DCPS. And so now it's my pleasure to turn it over to Ms. Burney, who will moderate the panel discussion for this evening.
Great, thank you, and good evening, everyone. I'm really thrilled to be here at Maury, the elementary school that my now high school age daughter attended. It feels like being back home, and really thrilled to be sitting with this distinguished panel. We have lots of questions that we want to get to, and so I am going to jump in. The first question I want to go back to the Chancellor. There was really great information that you opened and framed the conversation with, and want you to speak a little bit more to how within our plan we are leading with equity, prioritizing students furthest from opportunity, who need the most supports to come in person. Just wanted you to speak a little bit more to why DCPS took this approach rather than a hybrid or like an every other day approach.
Yes, so as we were thinking about where we were or where we are in this school year, the models in which we were considering this summer needed to be thought through, and we needed to reimagine what was possible. We knew that there would likely be some disruptions to a schedule change in the middle of the year once we've already started the year, and so that was a consideration. And so we wanted to ensure that it was the least disruptive model, and we believe that the in-person learning model throughout the week is a better way to minimize disruption, but also it gives us more time to have learning experiences in school for students who may need more time. So we prioritize student populations where we have had pre-existing opportunity gaps, and we know we have opportunities for dramatic improvement. So we have prioritized students experiencing homelessness for in-person learning classrooms, also students with special education services and language learners, and then also students identified as at risk. We believe that that represents a strong lens of equity, given that we know that these are populations that have had some opportunity gaps and will likely need some more time. These are also groups of students that we have seen some challenges with learning at home remotely, and so we wanted to ensure that we gave first priority to those student populations as we were thinking about in-person learning. And then finally, from equity, I do want to lift up that we have had the fortune of distributing over 30,000 devices to students to ensure that there was connectivity. Thanks to leadership of Mayor Bowser and the resources from the city and the city council, we've been able to ensure that students have devices when they need them. And we believe that this is an important ensuring that a digital divide gap is closed and students can learn appropriately. So those are the ways that we're thinking about equity and why we decided to prioritize particular student populations for our in-person learning experiences.
Thank you, Chancellor. Appreciate you answering that. This is our public health panel, and so want to dig into some questions around public health that many of you have shared with us. And so I want to kick a question over to Dr. Lee Beers. And just as a reminder, for those who missed the intros at the beginning of the call, Dr. Beers is the medical director in community health for community health and advocacy at the Children's National Medical Hospital and is the president-elect for the American Academy of Pediatrics. Dr. Beers, from a pediatrician's perspective, why is in-person learning important for children right now?
Well, thank you. Thank you so much. So first, I do want to just thank DCPS for inviting Dr. Shah and I here today to collaborate with you. I think it's such a really important reminder of the importance of collaboration between health and education to help keep our children safe. I'm a DCPS parent as well, and so I really appreciate both the efforts that you've put in, but also just really want to acknowledge how hard some of this has been for families and teachers and staff and administrators. And so these are just really difficult and complex decisions. I think that a couple of things. I think First, our highest priority is to make sure children stay safe, and I know that this is an important part of your plan. Some of the things that we've been seeing on the health side, certainly we know that return to in-person education is really beneficial for children for a wide variety of educational reasons. Some of the things we've been seeing on the health side that we've been pretty concerned about, first of all, particularly for the children we take care of who may have special learning or physical health needs or chronic medical conditions, they access some pretty important services in in-person learning that many of them are not fully able to access. For example, I have patients with cerebral palsy or with autism, and many of them are really not able to access the services they need and are really falling behind and losing skills. So that's one important piece. Another important health area that we've been very, very concerned about, and in fact this worries me greatly, is the mental health of our students. With the increases in social isolation and the decreased opportunity to connect with loving adults and supportive adults and their mental health services in schools, we've really been seeing really pretty significant mental health issues, pretty significant increases in very serious concerns, increases in suicidality, the number of kids who are expressing concerns about suicide, self-harm. So we really have been seeing some pretty serious mental health issues, and we're quite concerned about that. I think in-person school also has a wonderful wonderful place. It's an important place where kids have access to health and nutrition, good nutrition and exercise, and that's an incredibly important part of keeping kids healthy. The Chancellor mentioned this as well. Also, unfortunately, many of or alluded to this, many of our kids, or some of our kids, unfortunately, may not be in safe and stable homes, and may be experiencing toxic stress there. And so the school environment is really important for them as well. So a wide variety of reasons why, from a health perspective, it's quite important for kids to be able to access in-person school. Now, I want to reinforce, of course, and we'll say this over and over, and I know DCPS does as well, that this has to be done safely, and it has to be done safely for students, teachers, staff, everybody, and that is, of course, the highest priority. But also really remembering these reasons why in-person school, particularly for some kids, really is quite important.
Thank you, Dr. Beers. Yeah, absolutely right. Health and safety and well-being of our staff and students is paramount, and making sure that we put those components in place as we think about our reopening. And so with that, I want to ask Dr. Shah, what are some things that schools, teachers, staff, even students should be doing to ensure that our kids are safe, that they're staying healthy and safe?
Thanks for the question, and thanks for having me on. I do want to reiterate something that Dr. Beers mentioned, and just acknowledging we're over 7 months into this pandemic, and district residents, district families have made incredible sacrifices, and it's been an incredibly tough time. And I think we are still plowing our way forward, working through this pandemic, keeping ourselves and our loved ones as safe as possible. But I think we can be honest, it's been incredibly hard on everyone. There are ways that we could keep ourselves safe, our kids safe, and our family safe as well. And I do want to take a minute. I know we've heard about COVID-19 nonstop for 7 months on the news or anywhere you turn, but I do want to take a moment and just explain a little bit about what COVID-19 is. So it's caused by a virus that for most times gets transmitted through respiratory droplets. So droplets that come from your mouth, and they can extend about 6 feet to someone else. If you do get infected, you generally are infectious, so you could spread it to people a couple days before you start showing symptoms. Symptoms could be a sore throat, a cough, fever, or you could get really sick and end up in the hospital as well. And it's fairly contagious too, so many people are getting it. So the things that we do to protect each other actually keep that in mind. For example, we say we want everyone to be 6 feet apart when you're engaging in any activity. The reason why is because we know the respiratory droplets generally don't go further than 6 feet. So if we all stay 6 feet apart, we can make sure that we're being safe for each other, especially when we're engaging in other activities. Another really important task that everyone can do to make sure they're safe and others are safe is wear a face mask. A face mask does a few things. It stops your respiratory droplets from leaving. It catches it right there. It protects yourself when someone else wears a face mask because their respiratory droplets aren't coming to you. And also, if you touch a surface that might be infected, and something I do a lot, touch your face, the mask stops that. So that's why social distancing and mask wearing is incredibly important. Additionally, things that we could do are make wise choices. So really, you're going to hear a lot about the incredible effort and resources DCPS has put in to make the infrastructure safe for kids to re-enter school, and staff and teachers. But I think for all of us, we have to think about what we do outside of school as well, and what choices we make. And that includes not going to mass gatherings. When we have social events, or you attend a social event, make sure you social distance and mask wear. If you're feeling sick at all, that's when you stay home. And that includes a sore throat or a cough. And so those are just a few things that we all can do to make sure that everyone is safe going into school, making sure we have good mask wearing, social distancing, and ensuring that if you're sick, you're staying home and making wise decisions.
Great, thank you. It's helpful to have some of that context setting. I think we make assumptions about what folks know about COVID-19, how it's contracted, and so always helpful to hear some of the basic information about it. As we think about, actions that we all need to be taking to stay safe and healthy in our schools, I want to offer this question back to Dr. Beers or Dr. Shah, whichever one feels wants to chime in here. As we think about our protocol around ask, look, that the Chancellor mentioned at the top of his presentation, the process where a health professional at our school is going to inquire about and have students and families do some work ahead of time and answer some questions, and then observe and take a look at visible signs of COVID. I wanted to have one of you speak a little bit more to why that's so important, especially given what Dr. Shah just mentioned about the face mask being such a critical component in stopping the spread. Can you talk a little bit more about why ask, look is such an important protocol to have in place?
Sure, I could go first, and Dr. Beers, if you want to add anything afterwards. The ask, look method helps us have more guarantees and more layers to ensure that anyone who is entering the school does not have symptoms. Again, when we have that layer to ensure as best to our ability, I think one thing we should make sure is up front, all of these things, we're trying to get to 100%, but if we get close to 100% on multiple metrics, we develop multiple layers of safety, which is really important. So the ask, look method is multiple layers to ensure that children who have symptoms don't enter the school. I do want to make a point. I think a lot of what we talk about is really focused on what we're doing for kids or what our students are doing, but it's also equally and possibly even more important for the adults entering the building to have the same and even higher standards. For a young child, there should be leeway if they need some feedback on wearing a mask or social distancing. But I think we could all raise a standard among all of our adults entering the school building to ensure that we set great models for social distancing, mask wearing, also symptom screening, and ensuring that no adult is walking in through the doors with any symptoms as well. And I know I went kind of a little bit off the tangent. So ask, look is really just a multi-layered way to do that.
Ms. Burney, if I could just chime in on those layers. I know that we've talked a lot tonight about multiple layers of protections to keep our students safe. And we know that just one of those layers alone is not enough. But together, all of these precautionary steps and measures will keep our people safe. They will keep our students safe. They will keep our staff members safe. And I appreciate Dr. Shah elevating this point around, how we are thinking about staff, but also then how we're thinking about students, and then the way that we're thinking about health and safety collectively. And I believe these collective efforts will keep our students safe. And I'm very confident in that. And we believe that the steps taken on our building readiness checklist, coupled with these layers, will result in a positive learning experience and a healthy and safe learning experience.
Great, thank you. I want to, we're talking about things that families can do, that we will help them do. We also want to make sure, and I'm going to kick a question over to Patrick Davis, our Chief Operating Officer. There are expectations that our public, our staff, our families, our students have of us, DCPS, to make sure our buildings are safe and ready. And one of the things, one of the main areas that folks are really interested in is what we're doing for our HVAC systems, our heating, ventilation, air conditioning systems. Can you talk a little bit around, what we are doing, what DCPS is doing to keep people safe in our buildings, and when will school-specific HVAC information be released to the public?
Sure. Thanks, Shanita, and thanks for having me, and thanks for all the families that joined tonight. I just want to actually pivot back to what the Chancellor said, because I don't want us to think about the HVAC work in isolation. Obviously, it's very important. I'll go through that in detail, but all of the other sort of measures we're putting in place, as the Chancellor mentioned, come together and help us create a safe environment. I'm happy to dig into those later, but from an HVAC standpoint, we're really doing a few different things. First, we're working to increase the amount of filtration that happens in our schools, so making sure that we are filtering any particulate matter out of the air, so that it's a healthier air to breathe and learn in. Also, it helps reduce the amount of airborne transmission by reducing the amount of particulates in the air. And then second, we're actually increasing the amount of fresh air into our buildings and the amount of air exchanges in our buildings. And we do that through a few different ways. So many of our schools, actually large majority of our schools, have what's called a direct outdoor air system, or DOAS system, which is a system that most of the people in the building don't see. I think people recognize opening a window brings fresh air in, but for the majority of our buildings, we actually have systems that bring in fresh air. So one of the things that we're doing with contractors is actually increasing the amount of fresh air that comes in through those systems. So opening up the dampers to increase the amount of fresh air. That fresh air then goes through a filtration process. So we're bringing in more fresh air that's actually filtered. So it's actually cleaner than just opening the window and bringing in sort of ambient air from the outside. So there's a few different ways we're improving the air quality there. For some of our schools that don't have a centralized system or a DOAS system, we're going to be moving in and installing portable mobile Hepa filters. So these are medical grade true Hepa filters that have a UV light kit that essentially do the same thing. They recirculate the air and actually have air exchange and changes within the room, and actually bring that air and circulate it through a number of filters to reduce the amount of particulates that are in the air, and also help with air changes. So every single school will receive an enhancement. Each enhancement is going to look a little bit differently just based on system. So there's sort of broad categories, but each building is a little bit different. Age and vintage of the system and type of system. So we're at the stage of wrapping up all of the initial visits with HVAC contractors. So mechanical contractors going to all of our buildings, and we'll be wrapped up by Friday with all of those visits. And they're developing a very specific plan for that individual building to meet the needs based on the infrastructure that's there. All of this gets back to following the guidance of ASHRAE, who's a society of HVAC engineers. They put out guidance for healthy buildings, and we're following the majority of their guidance and tailoring that to the specific needs of our buildings. To answer your question of when that's going to be available, we've committed to, once the work is done, sharing the documentation from the contractor. That work is done with the school leaders, and we're happy to share that out with the broader community as well. I'll also add, as part of this process, we've engaged a mechanical engineer who has supported us in this effort, so they've helped with scope development, and they're going to be working with those individual contractors to ensure the work is done as we need it to be.
Awesome. A follow-up question, Patrick, for you. One of the things that we have heard from folks on is, okay, I hear that you're doing lots of improvements at our schools, or getting ready, outfitting the buildings and getting ready for students and staff to return. But how are we making sure that soap will be plentiful, that paper towels will be plentiful, that all of the materials, certainly above and beyond, that will be needed, but that basic supplies are in place? And with that as well, if you could just speak to how we plan to make sure that there is enough PPE in place.
Yeah, so certainly we're working closely with our schools to make sure they have what they need. So schools have gone through their process of ordering their normal amount of cleaning supplies and soap and hygiene supplies. We know that's not going to be enough. We know that we're going to be increasing the amount of hand washing we do in a normal, but compared to a normal school year, we're going to increase the amount of sanitizer and wipes. So to support our schools, we have gone through the process with our city partners, thanks to Mayor Bowser and her team have freed up a significant amount of money for us to purchase all of the supplies that we need. So we've received all of our cleaning supplies through our partners, and they're at our warehouse, and we're actually working to distribute that to schools. And we're standing up and implementing a monitoring process with the operational designees at the school. So we'll be able to track supplies that remain and actually forecast what our burn rates are in terms of each supply, and be able to proactively supply them with schools. So we're not, our biggest fear is we hear about something the day runs out, but we're putting the structures in place so that we have constant communication and systems in place to work with our schools, so we actually know how much supply they have remaining, when we're going to need to add more, send more out, order more. So we have what we need. In terms of masks and PPE, we've already got 1.8 million masks sitting in our warehouse, and we've distributed some to schools as some of the activities have happened during the summer months, but we're distributing a whole lot more, and more is coming this week. We are providing standard face masks. We're also providing child-sized face masks, dedicated face shields for school-based staff, and communicator masks for students that may need to, students and staff that may need to read lips. But all of that's going to be tracked, and we'll be able to fulfill those needs in a very timely fashion. We have the resources we need to be successful.
Chancellor, I want to come back to you. Will teachers and staff be required to have regular COVID tests?
So the current plan is to provide opportunities where DCPS staff members can be prioritized for regular testing, but that will be done on a volunteer basis. And so we'll make available locations and times in which DCPS employees can go get tested. And that will be communicated to all staff as we ramp up into reopening.
Thank you. I want to go to Dr. Bryant-Mallory, who leads our mental health work in DCPS. It was mentioned earlier in the call, in the meeting, that, and I think I saw some questions in the chat around, we're talking about physical health, but mental health is just as important. And so, can you talk a little bit around how we are preparing, as a district, preparing our schools, and schools are preparing themselves to address and respond to the mental health needs of our students and staff?
Sure. Thanks for that question, Shanita. I'm so incredibly proud to be an employee at DCPS, because we have been so creative and so innovative in our approach to preparing schools, preparing staff for what we anticipate will be an increase in need. So first, I want to talk a little bit about what we are doing at the universal level, what's appropriate for all students. And there have been three things that I'll highlight. The first is that we have created training lessons for classroom teachers that will help students do two things. One, understand the importance of following the health and safety protocols, and two, help them to understand all of the many ways that they can keep themselves and their classmates safe. And so the lessons are age appropriate, they are very high quality, and we'll talk about COVID-19 prevention in ways that are non-threatening and hopefully interesting for students. And so for most of our students, this is going to be enough to increase their comfort with being at school. We're also focusing on 3 R's, routines, resilience, and relationship building. This is work that we started with our schools back in June to prepare for school opening and prepare students for establishing trusting relationships, creating environmental stability within our school buildings, and creating opportunities to ease tensions and strengthen success at school as they return. Schools have received lots of strategies that they can use to employ the 3 R's within their schools, and it can be done in very practical and meaningful ways. And then the last thing I'll mention as it relates to universal supports is that we launched the Trauma Responsive Schools model this year that was developed in collaboration with many stakeholders across the city, Department of Behavioral Health, Turnaround for Children, some parents, some mental health staff, some school leaders, all participated in the development of a model that we are very proud of. And in this foundation year of the launch of the model, we're focusing in 5 key areas that we refer to as our 5 non-negotiables. And they directly connect to establishing routines, building relationships, and promoting resilience. I'll share with you quickly what the 5 non-negotiables are so that you can see the connections. The first is that every teacher will spend dedicated time with their classroom or homeroom students to build relational trust. We know that when you're operating in a classroom, everybody's not getting one-on-one time. But when I get to spend 5 or 7 or 10 minutes with my teacher, not talking about anything school related, I am building a trusting relationship with that adult in that classroom. The second non-negotiable is that every student is greeted with positive and affirmative language. This is also about establishing trust, building relational trust, building relationships. The third is that every school provides opportunities and designated space to practice emotional regulation. We know that students are going to come back to us with a wide variety of emotional needs. They might be clingy, they might be a little more irritable, they might be afraid. And so, we want to create space and opportunity for them to regulate themselves. And if that means taking a time out on their own, not in a punitive way, but giving themselves time to calm, we want to create that space. The fourth is that every school creates behavioral expectations for students and adults. And then the fifth is that schools include opportunities for staff wellness. We know that the well-being of our staff is critical to reopening because it directly affects whether or not our teachers show up as their best selves in the classroom. So all that I've shared just now was just universal supports, but we know that there are going to be students that need some more. And so this year, for the first time, every school has identified a school behavioral health coordinator that will serve as the point of contact for mental health referrals. This is a person that will ensure that there's no wrong door and that no referrals fall through the cracks. And every school has one as of this year. We also, because of Mayor Bowser and City Council's championing school mental health so much over the last several years, we have 13 community-based organizations that we're partnered with now that will augment the supports that we provide with our over 300 clinical social workers, school psychologists, and counselors. And so we have a strong workforce of folks that are dedicated to meeting this, expected increase in need. And then lastly, I'll talk about the services that are available within our schools. These 2 pandemics we're facing really did not catch us unprepared as it relates to the availability of relevant therapeutic supports. We're fortunate that we have had a foundation of addressing trauma exposure for many years now and have a trained workforce that has been tooled with gold standard treatments that are either trauma focused or trauma informed. And that includes grief counseling, child-centered play therapy, bounce back and CBITS, which are both cognitive behavioral interventions for addressing trauma, just to name a few. So we are ready and able to support your children and our students.
Thank you, Dr. Bryant-Mallory. Very helpful overview on our approach to supporting the mental health needs of our students. I'm going to kick a question over to Dr. Beers. that sort of spins off some of the work that you were just referencing. We like to, in our school, promote social emotional learning, supporting mental health needs by offering spaces where students can calm down or decompress rather, where they can do or being led in deep breathing exercises. Is it still safe to allow students and to have staff sort of lead them through breathing activities like that, or shared spaces where they might go and decompress? What do you say to our public when wondering, is that still safe now?
No, thank you so much. That's a really great question, and I think it kind of highlights some of the complexity of how hard some of these decisions are to make, because there's so many different individual circumstances that come to mind as you start to think this through. I think the first thing I'll say about this is this comes back to the concept that Dr. Shah and the Chancellor were talking about sort of layering protections, right? And so we know that sometimes things aren't going to go exactly as planned, and so a mask might come off, or kids might be a little closer than we want them to be, but if we have these multiple sort of protections in place, then that really helps decrease the spread, right? And so that's one important concept when we're starting to think about this. I think, with regards to the breathing exercises, I definitely think that's a good idea, and I think that it can be done very safely. You're going to have to think about individual schools and individual school setups, but if children and staff are keeping their masks on, and keeping a distance from each other, an appropriate 6-foot distance from each other, those are very safe activities, and I think also can be really centering, right? There's bound to be, this is a time, as everyone has mentioned, where there's quite a bit of anxiety. There's a lot of things that are really different, and so being able to have a centering activity like that will be important. In terms of some of these shared spaces and kind of calm down spaces, I think it's going to depend a little bit on the individual circumstance, right? It's going to depend a little bit on the setup of the school. It's going to depend a little bit about the things that are in the room, but I think if you can have a space like that, particularly that's dedicated to a smaller cohort of kids, so for example, a classroom, then that can be done very safely. I want to echo also just what everyone has been saying on the call to reinforce this as well, that there's, both in DCPS and across the country, as I get to see, there's been incredible innovation and creativity in how we can meet the needs of our students and do it safely. And I have no doubt that we'll be able to do that for our students as well in those circumstances.
Follow-up question there, and we can start with Dr. Beers and then kick over to Dr. Shah. Thinking about how students relieve stress and emotion and tension, and sometimes that's through crying, which, we know for those parents and teachers and anyone who's been around kids knows that, having a mask on, sometimes that comes off. Sometimes there is, you need to blow your nose, what do you say to teachers when they wonder, how is it okay to give them a hug? Is it okay to pat them on the back? How safe is that? And how concerned should folks be in those situations?
No, thank you for that as well. And of course, absolutely understandable that kids may be crying in class. I imagine most of the adults on listening to this have had a moment of crying in the midst of all of this too. So that's a very normal thing, right? And so again, and you may tire of hearing us say this, but this really gets back to this idea of layering, right? So if you've got a child and they're very upset and they're crying and the mask comes off for a second, you can help them get settled. You can help them get back together. If a teacher's feeling a little worried about it, they can perhaps put gloves on. That may help and provide an extra layer of barrier, right? But you can help the child sort of calm down and get settled, and give them a pat on the back, and help them get settled, and then revert back to those sort of safe situations. I think another, Dr. Shah talked a bit about sort of the circumstances that are most likely to transmit COVID. One of the things we've seen is that the highest likelihood of transmission of COVID is when folks are closer than 6 feet for more than 15 minutes and unmasked, if one of them is infected. And so, thinking about the amount of time as well is also important. And so I think just thinking about, using your judgment and thinking about how can you sort of help your child help the child in your classroom get settled, but also recognizing that, if one of those layers of protection fails for a moment, you've got all these other layers that are in place. You've got the screening that happened before children came to school. You've got the screening that happened at the school. You've got the cleaning that's happening in the classroom. You've got the PPE that the teacher is wearing. You've got the mask that the child is wearing. So you've got all these layers of protection in place. And that's the reason that we recommend all those layers, because we know that life is life. And sometimes sometimes things won't go exactly as we plan or hope. And so keeping those layers of protection will allow you to adapt to those individual circumstances.
Great. Dr. Shah, as you chime in there, I'd also love if you could speak to a question that many folks have. Are adults and kids different in terms of COVID transmission? Are there different ways that or levels of risk that children have or don't have that we should be aware of?
Thank you for the question. So going back to the previous one, I agree with Dr. Beers, and I actually would just trust our teachers, who are the experts, to make the right decision, to understand the safety needs in the era of COVID-19, but also understand the social emotional needs of that individual student, and to make that right call. And I think they will make that right call. In terms of transmission between adults and children, early on in the pandemic, I think there was a lot unknown on that. So when we had these questions, we really didn't have enough evidence to really say one way or another. Now we actually have 7 months of evidence. We have some evidence of other jurisdictions opening up schools across the country. So DCPS is actually in an incredibly strong position to think about planning for term 2, because we have a lot more experience with the pandemic than we did in March. Also, we have an understanding of what's going on across the country. I think I would say it this way. There is a difference in, when we look at the United States, the number of adults getting sick and symptomatic than children. There are studies that show a difference in those who are getting the infectiousness of young children versus adults. But I would stray away from kind of getting into those details, because at the end of the day, these principles are exactly the same. If we social distance, if we mask wear, if we ensure that you don't have symptoms when you walk through the door, and if you make wise decisions, then you're keeping everyone as safe as possible. So I would more, there's going to be always new evidence that comes out, but I would actually more focus on those principles. I do want to take a moment and talk about testing. I know the Chancellor mentioned that as well. DC has incredible access to testing through your doctor, also through public testing sites. I would encourage everyone to go to coronavirus.dc.gov/testing to see where you could get a COVID-19 test. If you're showing any symptoms, or if your child, anyone in your family, is having any symptoms such as cough, sore throat, fever, feeling unwell, we encourage you to get tested. While you're awaiting a test, you have to stay home. It's not we get a test and then we live our life. No, you actually have to quarantine at home and wait for a negative result. Or if you're positive, then you're quarantining and then you're going to be chatting with us about identifying close contacts. Also, another thing about testing, I do want to make a note. If you were exposed to someone who is COVID-19 positive, we do recommend you get tested about 3 to 5 days afterwards. But no matter, even if that test is negative, you still have to quarantine for 14 days. So these are things about testing that we want to make sure that everyone understands, and the importance of what happens while you wait for a test. And even if you're a close contact and get tested negative, you're still quarantining. Also on coronavirus.dc.gov, there is your phase 2. If you click phase 2, all our guidance is about different sectors and reopening and what measures that you could take to keep yourself and your family safe. So I would encourage that as well. Sorry, I had to plug that in.
No, I appreciate that. No, that's really, really helpful. Gosh, we're at time, and I mean, I could literally stay here for hours. There's so many more questions that I want to ask this panel, but I know we have to close out at 7. So I want to hand it back over to the Chancellor with a few closing remarks that he wants to make, that he's going to make, as well as, Chancellor, I'm hoping that in your closing you can speak to how DCPS is working with the teachers union to ensure that our safety measures are being met.
Thank you, Ms. Burney. Very fortunate to have you as our communication and engagement officer. You've done a phenomenal job tonight facilitating this discussion. As it relates to the we have very active and ongoing conversation around a common understanding and some type of agreement around our health and safety protocols. It was actually my last meeting before tonight's panel, and it was a very fruitful and productive discussion. And I look forward to more of those talks, and perhaps soon the president of the Washington Teachers Union and I can share more about the development of those conversations. So it is a clear priority for me. It's a priority for the mayor and for DCPS. For families, I just want to lift up the reminder about immunization. It's so important. I was surprised that our health experts didn't mention it, but I know it's top of mind for them. So thank you again, Dr. Shah and Dr. Beers, for joining the panel. But I think they would want me to remind all families that students, it's critical that families have the immunization records before students can report the in-person experiences. I think tonight the word has been layer, as we've talked a lot about layering in all of the health and safety protocols to ensure that collectively it is a strong response to mitigate any transmission of COVID-19. And then finally, just thank so much Dr. Bryant-Mallory for joining us tonight and lifting up all the social emotional responses that DCPS has planned and will continue to follow through on. Also a reminder to families, this is not our last session. We will have sessions throughout October. We have a session on October 21st on family and student readiness. We have another session on October 28th on facility and operational readiness. And then we have another session on November 4th around student schedules and a day in the life and student support. So we hope that you will join us for more of these discussions. And again, thank you to our panel tonight for an amazing presentation. And it's good to be back in school. And thank you to the Maury team for hosting all of us tonight in their building.
Chancellor, just wanted to add one other thing, that our school-based health centers are open through the end of October for immunization clinic hours. Just wanted to make sure that was known. Thank you.
Thank you.